Hello everyone. I'm going to make this video in English to reach more people. What we are going to do today is review a clean check. I have authorization of the patient to show dental pictures but not her facial pictures. So I'm trying to avoid that point, okay? Okay, let's go first to the clean check. I'm going to expand this window, and as you can see is the initial setup, is the first one. What did I ask to the technician in my prescript form? I set align and level starting with coronal movements to buccal, and after that move the roots of upper right canine and the incisors and also the left canine to the lingual side, more or less 3 millimeters. Do not procline incisors in the lower arch. Okay, I always try to give, let's say, simple instructions in the first clean checks to build the first setup, and then I spent a while transforming literally my clean checks, working on them. In fact, I only write this, or I give to my staff these instructions because they are the ones that submit the prescription form. So, in some cases, like in this one, in the point, I think it's number 9 in the prescription form, where it says crossbite corrected or not, they left the default option that is do not correct the crossbite, the posterior crossbite. But of course, in this case, I want to correct it. But as always, and as I've been always explaining in my courses all around, I want a quick, super quick first prescription form because I don't want to delay a single day that sending the case, okay? So when I get my first clean check, then I start working. If I see in the clinic that the occlusion of the patient is a good one and you cannot improve it, of course, I make those molars unmovable, as you can perfectly see here. If you move this, even trying to expand a bit, like a lot of students that I have had, a lot of doctors that received my teachings, they say, "Oh yes, Miguel, but let's do a bit of expansion." No way. And as you would see in a few minutes, expansion in most of the cases is not biologically acceptable. So, if you have something that is good, leave it like it is. Okay, I didn't ask for expansion in premolars, and in fact, in my clinical preferences, there is clear enough since 2010, I guess, that I don't like to expand the arches. In those strange cases, unusual cases, where you really can expand, then I would do it by myself, moving tooth by tooth. Okay, but even though in this case, as you can see, they have performed expansion. Uh, of course, if you go to the smile of the patient, and let's do one thing right now, and let's see in the PowerPoint, here you can see we have wide buccal corridors. But the question that you should always ask to yourself is, can I biologically expand? And the only way to know that is looking at the CBCT. There's no other way. So if we go to see the slices tooth by tooth, what we see in the molars, upper and lower molars, is that there's no bun on the buccal surface to expand. And they are absolutely well positioned, centered in their alveolus. Okay, so no sense to move that. But of course, if you look at the premolars, in the upper arch, there's possibility to expand, to change the torque the bucco-palatal inclination. But what would happen then with the occlusion of the lowers? Because it's clear enough that we cannot expand the lowers. If you take a close look to this that I'm pointing at, there's no buccal bone. In fact, as I see in 90% of the CBCTs in my adult patients, those premolars are partially out of bone before starting orthodontic treatment, okay? So you better don't expand this. The question that is arising now is, okay, can we change a bit the inclination, giving lingual root torque to those premolars, and just change the inclination until buccal and palatal cusps, buccal and lingual cusps of lower bicuspids are in the same plane? Okay, maybe that's the limit. But please bear in mind that we don't have bone on the buccal side. Okay, let's go back to the clean check. And then what I'm going to do, okay, first thing, as I'm sure that I'm going to modify these clean checks as 99% of the times we should do, I click on this one and it says that the crown is moving 1.2 to the buccal and the root is moving to the lingual. The other one, more or less same thing. But I go back again to my PowerPoint, I look at the number 14, and I want to move this root more to the palatal side, especially knowing that when we design root movement, in the best scenario, we are going to get the half of what we want. Okay, so we are going to over-engineer, as Barry Glaser told a lot of time ago, over-engineer this. Now, we are trying to move the virtual apex more or less 3 millimeters to the lingual, 2.9, and in the best scenario, we will get 1.5, I guess 1. Okay, so when we do that, what is happening with the lowers? We are moving the crowns 1.6 to the buccal. I don't like that very much. And we are moving roots to the lingual. Okay, let's try to move the roots to the lingual a bit more. Okay, we are planning a safer movement. Another different thing is what are we going to get in the reality? Because remember that the Clean-Check is a science fiction movie, and we are going to base that movie, to convert that movie in a based on true events, at least based. Okay, the other side, of course, we want to correct this. Let's see the CBCT, how the 24 is. Wow, we really need to change this. And in this case, we can, because it's crossed. Okay, it's in a cross bite. So let's move the crown. That's it, and the root to the lingual. Perfect. Okay, more than perfect. And now, of course, we have to move also the lowers and adjust everything. Okay, in order not to make this video too long, I'm going to stop it here because the most important things that I wanted to say, I have already said them. So I'm going onto the tiles without recording. And of course, if you have any questions, just text me and I'll be happy to answer that. Have a nice day.